Who is going to perform my hair transplant? Doctor or technician? Part 2. Which doctor? So in this video, I'm going to explain a little bit what a hair restoration surgeon is and topics associated with this question. So first of all, there is no official training at medical school that trains hair restoration surgeons. Even a plastic surgeon like me gets no training for doing hair restoration surgery. That is why hair restoration surgery is a self-trained branch, or it needs to be acquired from a colleague. Now this is very important because this makes the hair restoration surgeon like a rare animal which is almost being extinct. It's very different than any other specialties because firstly, as I explained, there are no new hair restoration surgeons being trained and released by medical school. Second is that in the past, like 20, 30 years ago, there were very few hair restoration surgeons, but also, hair restoration surgery was quite expensive and it was like a rare treatment that only the wealthy could get. And, doctors who are very, very interested in the topic would self-train or, work with a colleague to acquire the skill sets, and over time they would learn it at limited numbers. But the hair restoration industry grows so largely in the last 10 years and the demand increased so much that it was absolutely impossible that the supplies of hair restoration surgeons could, fulfill the demand. So now we've got a problem because now not only that medical schools don't train any hair restoration surgeons, hair restoration surgeons do not have the chance to self-train or learn it from a colleague. Because number one, the market is now so competitive to where it was 20 years ago that nobody's going to teach you how to do hair transplant. And secondly, it's become almost practically impossible for a hair transplant clinic to acquire a doctor and train them because it would take many years to train a hair restoration surgeon, and as soon as they train, they would leave and open their private practice. So practically, it's impossible for a large clinic that wants to do multiple surgeries per day to acquire hair restoration surgeons. Number one, because there are no hair restoration surgeons being trained at medical school, and number two, it's not feasible for a clinic to train their own doctors because by the time they learn, they would leave. So that the first part of this discussion is I tried to explain to you that we have to see a hair restoration surgeon as a rare animal that's almost extinct. Second, when you inquire for a hair transplant, you contact the hair transplant. This happens frequently in Turkey. And you ask, because you're hoping to get a good quality hair transplant for a reasonable price. Who doesn't? So you ask the question, who's going to do my surgery, doctor or technician? When you ask that question, obviously you are hoping that you're going to have a doctor involved, but at a reasonable cost. But there's a difficulty, as I explained. So what happens is, here I have to explain to you the cost of a doctor being involved or doing an entire hair transplant versus technicians. So obviously, the cost of labor of a medical doctor or a surgeon is much higher than a technician of, various backgrounds, sometimes no background at all. There's a huge difference in labor cost, but there's a much bigger cost that people don't think about. So it's not just about the diploma cost. It's about brand and marketing. So a doctor's name is marketable, but a technician is not marketable. So what happens here is that if you have a hair transplant clinic and you market your own name as a doctor, and if you did the hair transplant yourself, you're going to do 1 case a day, okay? But if you delegate it to technicians under your name, and there are clinics in Turkey that do that, you could do up to 100 surgeries per day under that brand. So what happens is, if you request the branded doctor to perform the hair transplant, the cost is enormous compared to if it's done by technicians. And the cost difference is not just like 10, 20, 30%. It's 5 times, 10 times if you consider that. So I see oftentimes, clinics have this practice. So now patients learned over the years that, most hair transplant procedures are delegated to technicians. So they started asking this question frequently. Who's going to do my hair transplant, doctor or technician? But what happened is that due to that huge demand, clinics found a solution. Okay? So what they do is they just put any medical doctor who has no training, no experience in doing hair transplant surgery, because as I explained, there are no trained hair restoration surgeons by medical school, and there are no self-trained ones coming freshly. It's just the old ones. So they just put a medical doctor with a diploma, and they say to the patient, the doctor's going to do your surgery. And the technicians show the doctor how to do the procedure, just so he'll be doing something during surgery. And then they offer the patient, look, if you want surgery by the technicians, this is the price. Let's say 1,900 euro. Or if you want a hair transplant done by a doctor, that's going to be 2,600 or 2,700 euro. And then the patient thinks they're, choosing between 2 decent options. Some of them choose one and some of them choose the other. But the point I'm trying to make here is that the price difference between those 2 options should alert you. If the price difference is just a couple of $100 between the doctor and technician doing it, be prepared. That doctor is just a diploma and nothing else. And chances are that hair transplant is going to be worse than the technician option. Because as I said, you're not going to get the branded doctor. You're not going to get the trained doctor, which has taken many, many years. And you're going to get just a diploma. And on paper, you're going to have a doctor in the surgery. But as I said, the price difference should alert you. If this is a real hair restoration surgeon, the price difference between the technician, if it's given by the same clinic, the offer, the technician and the doctor should be 3, 5, 10 times. If the price difference is 5, 10 times, chances are it's a real clinic. If the price difference is only 10, 20, 30% between the doctor and technician, you're not going to get any extra value by purchasing the doctor option, because it's just a no-name doctor with no. Chances are the technicians are much more experienced and skilled than the doctor. So here I'm not recommending you to choose doctor or technician in any way. It's not up to me. Actually, it would deny my training. I prefer that everybody chooses the doctor, but I'm just trying to explain to you, it's not just what you see on the surface. There's a cover-up, And so the main message in this video is to tell you, when you ask this question, is my surgery going to be performed by a doctor or technician? You have to ask, that question is not sufficient. You have to ask, which doctor, if it's the doctor, which doctor is going to do my surgery? Otherwise, you're going to get these diploma doctors which are not going to add any value to the surgery. And this method is now very well used by companies that are just putting a no-name doctor over there just for those patients who are looking for some extra quality. But in reality, what's happening is they're just snatching your extra couple of $100 with no extra quality provided. I hope that's helped.